Hydralazine is a medication used to treat hypertensive emergencies. While hydralazine is not a standard first-line drug due to its host of side effects, it is important to know for test day due to its use in specific populations. In this video, I'll give you my visual mnemonic to help you remember everything you need to know about hydralazine. Buckle up. We're going to be the first responders on the scene of a high-pressure situation. Okay. Maybe it's not the high-pressure situation you were thinking about, but just look at the water shooting out of that hydrant. By the way, this hydrant reminds me of hydralazine because, well, hydrant sounds a lot like hydralazine, doesn't it? Water from hydrants are always under a ton of pressure, right? The highly pressurized liquid coming from this hydrant also helps me remember that hydralazine treats hypertension, because hypertension just refers to high blood pressure. Hydralazine is specifically useful in hypertensive emergencies, described as periods of extremely high pressure, like systolics above 180s and diastolics above 120s. Prolonged periods of hypertensive emergency can lead to organ damage, so it's important to bring that pressure down. Hydralazine is also specifically useful in pregnancy-related hypertensive crises, such as preeclampsia and eclampsia. Just remember the highly pressurized contents of our hydrant to remember that hydralazine treats hypertension. So how does hydralazine treat hypertension anyways? As you can see, the water is streaming out of this open hydrant. Let this picture remind you of hydralazine's direct arterial vasodilatory effect. Hydralazine works through several mechanisms, but one of them is stimulating the release of nitric oxide from the endothelium, which in turn leads to cGMP-mediated vasodilation. Don't worry so much about the specific mechanisms here. Instead, you should remember that the effects of hydralazine are greater in arteries compared to veins. This fact should be pretty easy to remember, since arteries are under a lot more pressure than veins, right? Arteries are also red, just like our hydrant here. It looks like our open fire hydrant has caused quite a scene in the community. Just look at this kid playing with that dog in the recently flooded street. Wow, he really loves that dog. Just look at how his heart is beating out of his chest. We'll get back to the dog later, but for now, let's focus on that quick beating heart. This beating heart should remind you of the reflex tachycardia, a compensatory effect frequently seen in patients taking hydralazine. As we have already discussed, hydralazine dilates arteries, which leads to decreased blood pressure. This decreased blood pressure is sensed by the baroreceptors in the carotid sinus and aortic arch. A baroreceptor is simply a pressure sensor. In this case, the pressure sensor responds to a decrease in pressure by increasing the sympathetic response to the heart, leading to increased heart rate, chronotropy, and increased contractility, inotropy. Let's take a closer look because understanding this baroreceptor reflex is super high yield. During high blood pressure, baroreceptors sense an increase in stretch at the carotid and aorta and stimulate nerve firing in the glossopharyngeal and vagus nerves, respectively. This leads to increased parasympathetic input and lowering of sympathetic input to the heart, leading to a decreased heart rate, contractility, and conduction velocity. However, if the blood pressure is decreased, such as in a patient who has taken hydralazine, there is a decreased stretch at the carotid and aorta. This in turn causes decreased parasympathetic input and increased sympathetic signaling to the heart, causing increased heart rate and contractility. Because this increase in heart rate happens as a compensatory response to acute lowering of blood pressure, it is formally called reflex tachycardia. Reflex tachycardia and increased contractility with hydralazine is problematic, as it means the heart needs to work faster and harder. As such, hydralazine can cause acute angina in patients with coronary artery disease. To address this, you may see beta blockers being given alongside hydralazine. Beta blockers like metoprolol slow down the heart rate, basically preventing the compensatory heart rate increase. Alright, now I love playing around open hydrants, but doesn't this seem wasteful? Just look at all that water filling the streets. Now that I think about it, this flooded street is actually a pretty good symbol for the compensatory fluid retention and edema that occurs after taking hydralazine. This makes sense if you just think about it. Hydralazine dilates the arteries, lowering systemic blood pressure. However, your kidneys, specifically the juxtaglomerular apparatus, senses this decrease in blood pressure, and increases renin secretion to compensate. Also, remember that increased sympathetic response caused by the baroreceptor reflex? Well, it turns out that this sympathetic response also stimulates renin release. Renin then works through the renin-angiotensin-aldosterone system to cause an increase in fluid retention by the kidneys. This fluid retention is dependent on the downstream effects of renin and therefore takes time to manifest. This is why you'll see hydralazine given more commonly in acute hospital settings and not so much chronically as some hypertension management. Now let's get back to that dog. Wait, is that a wolf? Oh, never mind, it's just a husky. I always thought huskies looked like wolves. Let this wolf-like dog remind you of lupus, as in the lupus-like syndrome that some patients may experience after taking hydralazine. Lupus is Latin for wolf, after all, named for the classic discoid rash which resembles a wolf bite. Drug-induced lupus presents with many of the same findings as lupus itself, with ANA and even antihistone antibodies. But one distinguishing finding you'll see is a lack of anti-dsDNA antibodies that are seen in classic SLE. Another high-yield tidbit is that slow acetylators have a higher risk of developing drug-induced lupus. Slow acetylators refer to people who have low levels of certain liver enzymes needed to metabolize drugs like hydralazine through acetylation. Drug-induced lupus is important to remember, as it's one of the stranger adverse effects. And you know test riders love strange findings. Alright, let's wrap this scene up. Hydralazine causes direct arterial vasodilation, which can be used to treat severe hypertension, especially in pregnant patients. The arterial dilation leads to activation of the RAAS and fluid retention. Additionally, reflex tachycardia is a common side effect and usually treated prophylactically using beta blockers. Don't forget that hydralazine is also associated with lupus-like syndrome. Okay, that's all. Now let's get this hydrant shut off before the whole street is flooded.